reminders from me are needed. So congratulations on that. You know, it's hard. You guys right now are doing 3 classes, most of you, and it is difficult keeping organized. So
So
whichever,
Barbara,
yes, Jamie.
sorry, there's one of the students is in the waiting room, can't get in.
Okay, I don't have a waiting room.
Maybe she's
Tell
in
her
the
to-
wrong waiting room.
There you go.
I'll let her know.
Okay, there's no block up right now at all. Yep, see, nope, nothing's not there. I just checked the, you know, the settings and it was fine. So it is week 3. Here we go. We are doing school age adolescents, and we will have covered from birth to age 21, all of those things that those children do, and how as nurses are we going to take care of these children, how to approach them, developmental levels, when to find delays, or even knowing when children are advanced by that. So school age adolescents, ages chapters 34 and 35 today. This week you have quiz 2 that's due. You have 50 NCLEX questions that are due, and the case study Burns is due by Sunday. It is open. Most of you already have it done, so good. Next week will be your first exam. It'll covers chapters 26 to 35. It's a lot of information. So you did get your review PowerPoint last Friday, as I had promised you. So we are doing reviews. I do the first one tomorrow at 5:30. The next one is Wednesday at 6, and then Thursday, I believe 5:30. It is on your calendars in your Canvas. So I made sure it was posted there as another way of you being alerted. So those are there with the Zoom numbers. Now, all of these reviews you get copies of. And what I do is I don't send you one at a time, so you have to look. I will take one of your, it'll say exam review recordings, and I will keep editing and putting in the reviews. And I always attach the PowerPoint for that study guide there too. I don't want you to have to look through 50 different, announcements looking for what you need. I try to keep that organized for you. So you'll see the recordings as I get them will be posted on the announcements. So my recording, usually, sometimes I can get it in, tomorrow night after. Sometimes it takes a while for me to get that recording, so I have to do it the next day. But if it's the next day, it's around noon, definitely it will be in there. And I will upload it to my YouTube channel. Has anybody had a chance to go look at the recordings on my YouTube channel yet? Does anybody you have? And what do you think about using that forum? Is that make
it's very helpful. I once tried to look for the YouTube channels, but I couldn't find it.
Okay, it's
Maybe
Professor Bogart's Pediatric Nursing. And if you go to the announcements from last week, where you got the recording, you will see a link to the YouTube channel. And from there, it'll probably be easier to find some more stuff too. Now, are any of you lacking in dosage calculations? I have a recording there from last semester, which is amazing. Now, it is not dimensional analysis, but it shows you how to pull numbers out. I only use 3 formula for everything. And the way I describe it makes it simple. It is a great review. Now, if you go there and you want the handouts, there's 3 handouts, I believe, I can send them to you. So do you all want me just to send you the handouts for you? Because they are a guide on what you're going to see on the exams, the similarities of questions, okay? And then it goes into pediatric questions. And then I also had one there for med-surg too. Your mics per kilo per minute, any of those questions. I make those questions so easy. You're going to say, boy, how come nobody explained it like that? And that's usually what I get. So, all right, what I'm just going to do, you all, let me just hand you all of the documents for the dosage calc. Not a problem. As I'm sending out information, probably tomorrow by noon, you'll get it. Now, if any of you need tutoring on dosage calc, I will set up a tutoring session with you. If 2 or 3 of you want to get together sometime, let me know. I can work. I'm pretty free on Tuesday, Wednesday, and Friday afternoon this week. Okay, Thursdays, I'm double class, so that's pretty booked. So if you need something, you let me know, all right? And I'll work with you. It could be 15 minutes to an hour, whatever you need, I'll work with you and make it simple. I have taught many students who said math, they just didn't get, never have. I made them get 80s on their dosage calc HESI. So if I did that on that type of person and got them to there, you know, I can teach you in a manner that makes it sensible and understanding, okay? It's just just thinking, you can figure it out now. It's very logical to me, but I'm a math nerd, so anyway. All right, so today we're gonna do our PowerPoint first, and then of course I have a Kahoots, which I will send to you. For your exam, please review these Kahoots because the concepts you're seeing, you're gonna see on the exam, okay? So it's a great review along with the PowerPoint study guide that I'll be going over to, okay? So those are a great thing. So come to class a little bit early next week, maybe 15 minutes. We'll get you all set up. I usually get you going by 5 after 3. And then we do come back for a class afterwards. And what I do is I only do a Kahoots. But what I do is describe those concepts. You're going to see that we are going to get a lot of similarities into med-surg as we go into our diagnoses of cardiovascular and neuro, etc. You're going to endocrine, metabolic. You're going to see these things in med-surg. You're just studying them, and then, you know, right after you're done, now I'm doing it. So there's a lot of repetition there. So I'm going to try to help you understand those things too. And I've had many students say that just because you had it already med-surg or you did it that week, and then, you know, the next class with me, we're redoing it, you know, that repetition helps. So I hope it does. So that will be next week. So we will be running right till 5, okay? But you will have all the time you need for your exams. And I will give you preliminary grades. Just send me a message and I'll let you know. Some of you just absolutely just need to know that you're having a stress attack, or I don't think I did good, or well, I think I did really good. I wonder what it is. I mean, I understand both ways. So I do send them if you want them. Just know it is not your final grade. It still has to be reviewed by the pediatric professors, and we go through each question to ensure, was it fair for you? Was the question fair? Okay, so we do go over exams after each and every exam. All right, let's go to our PowerPoint. Andre, Tina, Crystal, are you on camera? Nicole, Alexis, where are y'all? Andre, you're driving or sitting in a car? Okay, you can go off camera because it's going to be changing and flickering. Crystal, thank you so much. Alexis, Tina, and April, I've given her okay. Nicole, are you there? Okay, beautiful. I want to make sure people are here, you know, in front of the camera. I know that there's people who just turn off the camera and leave and really don't watch classes. And I understand why that would be done, but who gets lost with that? The student does, because it's better to sit and watch a lecture than it is to go back and look at a recording, even though you can watch it over and stop it. I think that listening to it in a class, you know, and sitting here and listening, hopefully we'll be able to learn. So here we go, school age children. These are ages 6 to 12. You know, they start out young, and then at 12 years old, they're almost teenagers. So there's like a really big gap in developmental levels in school age children, just themselves. So it starts with, you know, the baby teeth falling out, and then it ends with puberty, and all the permanent teeth are going to be in there. This is a stage where children do not gain a lot of weight quickly. They do not get taller quicker. It's again that step stairs type of thing, and it's slow. When they're 6, they're still very immature emotionally, physically. They're more awkward, not as limber as a 12-year-old, but that all changes as they gain years and years. So as I said, it's really not that much. It's 2 inches a year, 2 to 3 kilos per year. But by the time from 6 to 12, their weight's going to double. And when they get to be 12, boys and girls are still the same. You don't have the boys are taller than the girls. You don't see that. They're still pretty equal by this point. So their movements, as I said, become more graceful. Their legs get longer and longer. Used to be the trunk was longer. Now the legs are catching up. All of that fat is going away and we're getting more muscle. That head circumference has nothing to do with the height or anything anymore. There's a lot of things with head circumference in children. I think you've seen that. And then, of course, we go from this big, pudgy baby face, and they start to mature and become grown-ups by age 12, and they're starting to look so mature. And I love it. It's the age of all I want for Christmas is my 2 front teeth, right? I remember being there with my teeth out, waiting for my dollar for each teeth. Absolutely. So these children now can hold their urine. They're not going as frequently as they were when they're younger. Their chest is getting bigger, their body bigger, so their heart is becoming smaller. Earlier, the heart took up a lot of space in the chest cavity, but now it's becoming smaller. Their immune system, they've been getting sick, picking up viruses, getting immunizations, eating good nutrition. Their immune system is getting really good now. Now, their bones, when they were softer as an infant and younger children, are now becoming as what I call more brittle. They ossify, they get stiffer, so that quick molding and bending and healing is not as quick as it was when they were smaller children. And we know these children, there's some 12-year-olds that look like adults, but it doesn't mean that their mind is caught up there. And then, of course, there's some 6-year-olds that act like adults because, their mind is caught up there already. So be careful of this age of children. So prepubescent is, they call it 2 years before 13. And what they're saying is, before they have puberty, after puberty. Now, the one thing we need to know about it is girls go through puberty about 2 years earlier than boys. And they say it's about 10 years old. Boys don't go through puberty until they're about 12 years old. And we know there's different changes that we go through puberty, and Tanner's is in the book, read through how, it's breast buds first on girls and, an enlarged scrotum on the boys. So there's different changes. Now, when you are assessing these school-age children, again, remember they're 6 years old to 12 years old. How are you going to talk to them? So again, in their level, sometimes, explain, you're going to go for an X-ray and they're, on your chest, and a 6-year-old could get really frightened. They think of gamma rays and radiating through your body and, they're going to blow you up and kill you. And just think about what a child might think. So if we just said, just like a picture on your cell phone, you take a picture, but you can see on your insides, but it doesn't hurt to do it. You just take a breath and then I'll show you your picture. Now, that is easier to understand than going for an X-ray. It's not going to hurt. They don't understand that because all they hear is X-ray. And what is that to them? We inspect children by looking first. I mean, you could look at a child and see if they're sick. If they're running around the room, they're not as sick. If they're just sitting on mom's lap with their head down and just looked all droopy-eyed, no. Just by looking, I know something's going on. Then we're going to listen, percuss, and palpate and see what's going on. Remember, lymph nodes are non-palpable on a healthy child. Only when they're sick do you see lymph nodes. Another thing is, as we're doing our assessment, like health assessments, how do you assess the hypoglossal nerve on a child? Well, have a child stick their tongue out. You can have an infant do it too. Ever play with an infant who's in that imitation stage, that 4-month-old? You stick your tongue out a little bit and move it, and the baby just tries to get their tongue out because they are doing the imitating. So it can be done even on the infant, but absolutely on school age. If you're listening to bronchial sounds, you need to put your stethoscope over the trachea or the suprasternal notch. Now, this is the bronchus. This is not lungs. These are the tubes that feed the lungs. And why would we want to know bronchial versus breath sounds? Well, many children have a lot of junk in the upper airway. And that's noise in the bronchus, which if you take a deep breath and cough and get it expectorated, those sounds will decrease. It'll be clear. So it's a difference in treatment, is it? So is it low? Is it gurgling in the lungs? Or is it just this phlegm up in the bronchus? So Freud, we didn't talk much about Freud, but Freud's all about relationships at this point. It's heterosexual is what most of Freud is at this point right now. He knows that school-age children's friends are same-sex at this point. This is where they're comforted. This is, the younger children have girlfriends and they don't really have girlfriend boyfriends, according to Freud. Okay, they're starting to learn of the differences between boys and girls, but their best friends are those girls. Now, Erikson is a talk about industry. Erikson says that school-age children like to do things well. They want to be independent. They want to do things, skills that other kids can't do and do it better than them. And that's why this peer approval and being looked at like, wow, this kid can kick that ball farther than anyone, or this one can spell anything. My goodness, they spell great. Or look, in math, if you want to know something, go ask, Sally, that they're good at something. It could be pianos, could be cooking, could be sports, anything. Their industry is what they can do, which gives them good feelings about themselves. Now, it is what we call industry versus inferiority. That's school age. Well, what's the inferiority part? Well, they can't do everything well. And they feel like they're so good at spelling and math, but they are really horrible kicking that ball. And they're the last kid picked for a team. That's the inferiority, okay? They want to do something, do it well, but they're unable to. So they feel like ashamed of it, inferior. They don't feel good about it. So there is the industry they do well, and the inferiority is what they can't do, but they really would love to be able to do everything. Now, Piaget talks about learning, is cognitive awareness, learning about events, what happens at them, and then it's taking ideas and bring them into fruition. They call it things like conceptual thinking, like they want things and ideas. Well, I have a project for school and it is a map. Well, why don't I make that map so it stands up? Can we build houses on or something? And this is now taking a map, simple, and taking ideas, being conceptual, like, oh, let's put it up and make it look like that. That would be great. The concept of conservation. These children know that if they have 5 uniforms for school this week and they dirty an extra one day they're not going to have a uniform, and it might mean they have to do laundry themselves. So they'll make sure that they have a uniform for every day, no matter what. Or I always use this as an example. My children on Fridays, I would always, with shopping, would get them Little Debbie's cakes for the week. They both have a box of 10. Okay, they could share them or they could eat their own. Well, they knew that they weren't getting another box of Little Debbie's till that next Friday. So every day when they came home from school, they could have 2. Well, if they ate more than that, guess what? They didn't have any. So they learn to conserve their little Debbie's cake to make sure that when Friday came, that before I went shopping, they still had their little Debbie's cake they could have when they came home from school. So that is a great, I think, understanding of how you start to learn those things. You know, conservation, you think people do, or saving the milk, make sure you have enough milk for cereal all week long, or whatever it is, it's a conservation. Now, there's also different things of understanding. If you have a tall glass, a short glass, you put the water into each glass, it looks different, but it's still the same amount. You have a ball of clay, whether you smush it or leave it round, it's still the same amount. Doesn't matter the shape of things, how you position them, they're still the same number of things. So school age children are starting to understand all of these things. It's still the same number of coins, doesn't matter which design I stick them in. And then again, Kohlberg. Remember, Kohlberg initially, you know, with the toddler preschools, talk about good and bad consequences for each. And, you know, now they know reward and punishment. And they also know that what they're going to be punished for, and is it worth doing it? Okay, was that punishment worth doing it? Like, you know, sneaking out, you know, to get an ice cream at the truck, but you got found out, you know, it could be as simple as that. And also they know that these rules, all of these feelings, there's other people inflicting these things on them, and they need to go forward with those desires of the other person if they want to have good rewards. So reward and punishment, they do things because they want to be rewarded. They know if they don't, there'll be a punishment, but they select their punishments, they can. Spiritual thinking, well, now by age 6, you know, depending on what your religion or what your beliefs or spirituality, children are really understanding. They understand, you know, that whatever you have taught them, like, is Christmas going to church on Christmas Eve, or is this just Christmas tree and presents, and, you know, that it is baby Jesus? What is it? What, it doesn't matter. It's what the family has brought to this child. And they're really starting to understand, and they really want to know more about what is this God, okay? They believe because there's a God, or their super ego, right? They're conscious, if you think about it, that they will be punished if they do things wrong. And they also believe that if they get sick, something hurts them, that God has punished them because they did something wrong. Now, I've actually used this concept in taking care of children working in the emergency room. I would have very young kids, 6, 7, 8 years old, come in that had appendicitis. They needed to go to surgery. And before I would start anything, and we've already determined it's appendicitis, I would sit next to them and I would say, there's nothing you did wrong that caused your appendix to say it doesn't want to be here no more. It's sometimes pieces of your body said, you know, I need out and I want out now, but you didn't do anything wrong. You told mommy it hurt, you got here, you did it all right. And you know something, I'm going to make sure the doctor sews up all the stitches so nothing can get out when you're done. So you're not going to lose blood and you're going to be okay. And nothing you did was wrong, even if you hit your brother yesterday. And they give me a hug. You could see relief coming over their face. And it brings this child where? Into surgery, as I know I did nothing wrong. We're just going to take it out and I'm going to be fine. And that was taking what? 2 minutes of my time. And this child's going to have such a better outcome all the way around. Social peers are important. You know, they'll switch activities from soccer to baseball. They'll switch the girls, you know, instead of being on the ski team, they'll be on the volleyball team, whatever it is. You know, this age, they are going to do what their buddies are doing because they want to be a part of that right there. So remember, as they're getting older, what are children doing? They're becoming more dependent upon friends and teachers. They're getting away from their parents. So they're a really, really strong influence on these children. You know, even when they go over to their peers' houses, those parents are now becoming a strong influence, and they're starting to get them ready to go away to school or to move out of the house as they get older. It's part of the growth of working with other people, okay? And what their sex roles are, it depends on their peers and what everybody's doing. You know, all peers, all these school age children want to do is to belong and to be respected by their peers. And they want good things. They want to be able to do things. Clubs, peers groups are good. Again, it's organized, working together as a team. But remember, as all children are, there's that bullying, whether it's school, whether it's a peer group. I got more badges than you do, and you didn't get that one because you didn't. And these are what children do. But again, isn't that what life is as you get older? Start working for people and people don't treat you right. It's really preparing you. The relationships with the family is so important. The parents still need to be parents. They're not friends yet, but they need to be there to still monitor, watch, look over them, you know, give them that independence is what they need, you know. And remember that parents sitting down with those children, let's say if you have a chance every dinner time, you know, like they used to be able to do, sitting down with parents, whole big family for dinner, sitting to talk, how was your day? And what happened with, you know, the kid who was bothering you the other day? And, you know, really being a part of their kid's life, so important. Play again, you know, I talk about play all through pediatrics. You know, there is very important. It works again with their mind and development. They're really starting to know who they are. They want to have nice clothes. They want to have their hair just right. They want to, you know, the appearance. They want to be able to do things well. And they do have good values. They know right and wrong. They know that if they do something wrong, they'll have a problem. So there is a conscience there. And it's not just parents. Remember, there is the peers, parents, there's the teachers, and all of these adults do have, give these children some piece of themselves. So we need to promote self-respect and confidence. And that's as, you know, nurses, we can, you know, tell them what great jobs they've done and don't ever start with, you did this, isn't that wrong? But this was okay. No, you start with, you know, you really did this well. But maybe next time we could do this like this better. You know, it's those things that help these children. Their body image is becoming more and more. They know that there's differences. They know that people are different from them each other. There are also children who need braces and need glasses and hearing aids or whatever. Those, remember, this is still body image. It's not as severe as adolescents, but still, they are very concerned about what they look like. When they go into, you know, their first real school experience in kindergarten, you know, this is getting stricter than preschool than with daycare. So now you have them really into a longer period of time. You have them, you know, following somebody else's structure, somebody else's rules, you know, and have to get along with it. It's just part of the development. And friends, peers are so important at this point, you know, for them to be able to talk with. Nutrition, 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 nutrition. You know, school age children is that time of life where we can make big influences in them. You know, allowing school age children to become well overweight. You know, we should be teaching them about the good types of food and, you know, what they need to do to be healthy. This is they're so open to all of these ideas at this age. You know, this My Plate is online and it talks about types of food they can eat. You know, I know today, you know, with parents working, the easiest thing is fast food, right? Right through McDonald's or, you know, Taco Bell, and those foods aren't the best, but sometimes, you know, that's all we can get because we're so busy as parents, and it's understandable. So as I said, you know, children can get big and get, you know, quite large due to many different reasons. And usually it's due to some sort of emotional that's going on with them. You know, I've got two grandsons who got a little pudgy because dad was, deployed and they missed him. So during that time, I could see them getting a little pudgy, but they're back outside again with dad doing all the things they need to do. But this is children. This is part of their stress, is it? But there's also, why are children heavier than ever? Well, it's because they're not as active as they used to be. It's easier to pick up a video game or a phone or some computer of some sort and play games, for 12 hours at a time. I've got a 5-year-old grandson who has his own iPhone that's not connected, but he uses the YouTube channel and watches videos. And this is just, he would be there 12 hours a day, which we don't allow. Now, he's learning a lot, but, he's not up and moving. Well, the kid's skinny anyway, but that's not the point. He needs to be up and moving. Now, sometimes obesity is because they can't go out in their neighborhood. It's not a good neighbor. It's not safe for them. But when we have children who are overweight as a child, they're going to have an increased risk for hypertension, diabetes, high cholesterol, which this is because of the cardiometabolic changes. It's the way their body changes in storing fat and sugar and salt. And then this is all because of overweight. So children can become adults that are going to suffer from all of these many things. So when should we start this thing about not letting children become obese, and keeping them at their proper weights? Well, it should start as early as prenatal and in infancy for sure. That's why we're monitoring the weights. That's why every time they go to the doctor's office, there's a height and a weight. It hits all ethnic groups, all cultures. There's not one that's more than the other. And as I said, school age children are those children who really are enthused to learn. I mean, I remember going to Dare to Keep Kids Off Drugs program and going to the middle school with my children and watching those things. And they were so interested to learn, and I smoked cigarettes then and they wouldn't let me. That's when I quit, because that was a bad drug and I shouldn't be doing that. And as a parent, I had to do it. Now, one of the things with obesity is we are all taught that there's poor countries in the world and you need to finish your plate. Now, the problem is children aren't hungry every night to eat an entire plate. What they say is children eat, especially school age, the younger ones, they eat what they need. And if they don't finish it, it's because their body doesn't need it. Because school age children, toddlers, preschoolers, they eat enough food. They know what they do need. And for us, sometimes it's not enough. Well, it actually is enough. So you shouldn't force a kid to finish a plate, because that could mean them for life. I've been taught to finish my plate. So all through their life, then they're finishing their food all the time, whether they need it or not. Sleep and rest is 9 to 11 hours for the younger, and then it gets less for the older children. And the 6-year-old will fight going to bed, but then when you get up to the 11, 12-year-olds, when they're tired, they go to bed. It's not going to be as much of a fight. Children in school age are in sports, they're in clubs. Like I said, this competition is good. It helps with the physical and emotional maturity, and they love competition. They love to win. All I hear is about, I won, right, Nana, I won. Sure, you always win with me. Dental health important, as I said, all the baby teeth out, all the permanent teeth in. So really good dental hygiene is needed. If you lose a tooth, what happens? The whole tooth falls out right from the root. How do you take that tooth? Now, this is a permanent tooth. Come out and you see it sitting there. What should you do? How do you get that tooth to the doctor? Because you can reimplant them if you get the whole root. You put it in cold milk. Cold milk in a container, a baggie, whatever. It keeps it, I think, the cool and the calcium, and they can numb the area and push the tooth back in there. Many permanent teeth are saved that way. I've seen it done a couple times, and they really force it in there, but I've never seen a kid yell like it was horrible, painful. It was just the force of pushing it into, like, it's usually the upper one, the front upper one usually. Sex play is normal, it's curiosity. At this point, parents need to be starting to talk to their children about, proper touch, etc. As a nurse, if they're asking us questions, this is a normal part of growth and development. If they're asking questions, find out what they are understanding, because there is, sex, as we know, and then sexuality, that expression of, sexual desires or sexuality. And then those values about sex. Remember, in nursing, the younger children, we're not going to sit there and tell them, if they want to go to Planned Parenthood under, age 12. I don't believe that's the right thing to do. But as an adolescent, we would give them written and oral instructions. They ask us specific questions. But school age children, we just need to know what they know. Some kids just know what the kids have said. School health, those nurses, they really went through a lot when COVID came, making sure parents had the information, keeping up with what was going on. They keep up with infections. They watch the flu. They watch things like immunizations. They do so much for the school and the community. I mean, you've seen probably handouts if you have children that come, that there was a case of meningitis, that if you have a child in this room or went on this bus, they should get a prophylactic antibiotic, blah, blah, blah. It's like, and then they follow up on these things. So school nurse can be fun. You also get the same schedule as your children. You're off in the summer if you want, and you're off, for Christmas break. So many people, young children, go to be a school nurse, and the pay is not that bad. Injury prevention, always, always. So we know, again, motor vehicle is always going to be number one, any level of child. They should stay in the rear seat till 13 years old. This is what's recommended, okay? I know that I had my children in the front seat with me. They would call shotgun, when their father and I got divorced. They were 9 and 11. They'd be calling shotgun. I guess they should have had them in the rear seat for a lot longer. And booster seats, they say till about 8 years old. Many of us take them off, before then, but it should. Bikes, they should wear helmets and always protective type of equipment, whether it is a helmet, whether it's shin pads or shoes, really should be done. The year they came out with that little motor scooter, the one with your legs that you could just make it run, I saw 2 cases of bilateral fractured radius and ulna, both the arms fractured, little boys on that little scooter. First Christmas they came out, they didn't have any of the wrist restraints on. They broke their wrists. So, I've seen, please get that equipment on well. And trampoline, highest injury. I will not ever have had a trampoline in my house because I know what can happen to them. And I didn't want that because all the neighborhoods came over to my house to play. So families, what are we doing? Well, you need to let them be independent. Like I said, you need to sort of give them what they need to know, but not let them know that you're really telling them, or being unobtrusively as possible. Yeah, I mean, you're sort of talking to them, but you're not preaching to these children, because they need to make mistakes, but you need to keep them safe. And they go from only family, now they're getting little connections in the neighborhood. School age children do have things like ADHD. This is one of these things, it's not being able to focus on completing a task. And the problem with ADHD is not that the child has it, it's that he's usually disrupting the other children in the class if he can't sit still. So many of these children are sent to the nurse. Now, if you were a school nurse, this children came to you, the one thing I suggest is that, first of all, ask the parents what they've tried to do already, because many of these parents have already gone through their pediatrician, gone to psychologists, gone to neurologists, gone to therapies, tried things. So first of all, listen to the parent. What did you do so far? What have you done at home to try to help this not finishing the task, okay? And then make a plan of care. Because many of these children have, these parents have these children on a strict structure, and they can only do certain things, and they make sure that they finish things at a time. And then some parents aren't, so make sure you know. So the knocked out tooth, the parents are reluctant to re-implant it themselves, thank goodness. Where should the tooth be placed for transport? What did I say?
Whole milk.
Yes, ma'am, cold milk. So now adolescents. This is the children which I tell you is hang on for the roller coaster ride, because now these are children that are maturing, that want to be more free, and they want to be able to make bigger decisions. And as a parent, it is difficult. So hang on for the roller coaster ride. It is a transition between childhood and adulthood. It is rapid physical, cognitive, social, and emotional maturation. You go from a child at age 12 going into 13, and then you go up to age 20 where you're mature, going to school, or you are living on your own and working. I mean, the maturity is very, very quick. The beginning of adolescence is the appearance of the secondary sex characteristics, and it ends when the body stops growing about ages 18 to 20. So we know there's primary and there's secondary characteristics. Well, primary is what you need to have a baby, okay? Sex organs. Secondary is all that hormone, the voice changing, hair growth, breast enlargements, your fat moving, getting curves. And these have nothing to do with having a baby, but that is the secondary sex characteristics. Boys, the first pubescent change is testicular enlargement. Girls is the breast buds, and then the boys are the testicular enlargement. That's the first thing you start seeing. And as we see, Tanner stages, and exactly, you go from absolutely nothing to boobs, you go from no pubic hair to too much, you go from a smaller penis and scrotum, and then you go to, everything. So that's part of Tanner, and all of this stuff goes on between those ages of 12 to 18. Now, there is this adolescent growth spurt. They almost call it like this pre-adolescent growth spurt. It's like right there as they're going through puberty. They gain 20 to 25% of their total weight. This is a lot of weight. This is when we start seeing, especially boys, eating so much you can't keep up with them because they are gaining so much weight because they're getting so tall. So you don't see it. So 20 to 25%. They need good nutrition and they need good rest. Doesn't mean they get the rest at this age because there's so many things they're doing, but they should be getting some good sleep at night too. Now, girls and boys both get the voice changes, but I think we most notice it, with boys. I know, speaking to my nephews on the phone, with my other girlfriend, her son, all of a sudden that voice went down. I'm like, oh, is this Mikey or what? The voice changed. He goes, yeah, my voice changed. Now, Erickson talks about a sense of identity. Well, it's body image is part of it. And then who am I? Where do I fit in? Am I the music nerd? Am I the sports? Do I like, what do I like? Where do I fit? There's all different ways to go. And then do I like girls? Do I like boys? Do I like them both? Do I like nobody? It's figuring all these things out. It's such a confusing time. So it is looking for their sense of identity. Who am I? What am I going to be? So the development starts, that you are still needing mom. And by the end of this adolescent, you're going to be able to live independently away from parents because you've been exposed to other people along the way. This is a really hard time for adolescents. We call it intense sociability and intense loneliness. If you can think that adolescents love to be with their peers, whether they're going out to the park or the basketball court or the mall or down at the, the McDonald's or wherever it's at, they like it. Now, what happens if all of a sudden you're dating this guy and all of a sudden one of your good friends you see out with your boyfriend? So now you've lost your best friend, one of your best friends, and your boyfriend. That's your intense loneliness, because they go through all of this excitement. Something happens, which is all part of adolescence. And now they're just really all alone. Nobody loves me. Okay. Everybody's against me, even my friends. It's so important to be accepted by peers. It is so important. And it's not only being accepted for those peers, but also, that those peers are people not going to hurt them, right? So relationship with parents. Now, this is a hard time. We know that we've been protecting them. They've also been dependent on us when they were school age. Now, as adolescents, it starts to become more of an affection, trying to let these children live a life, but within the rules of the house, which is hard, right? So you will see teenagers struggle between privileges and responsibility. So you can go out this weekend to the mall and the movie with your friends, but this week you have a math exam and you need to do well on it, and I want you to finish your laundry. Those responsibilities, or take out the trash, or whatever that responsibility is, the responsibility to themselves, to their school, and to their family. Those things must be done. And they just want to go and forget about other stuff. And this becomes, that conflict. And this major conflict of this independence and control is around ages 15 to 17. It's right at that age where they're not old enough, they're not young enough, they just want to be able to go and do what they want when they want. So as a nurse, if your parents telling you this, what would you say? Well, I think that they need to sit down together and make a compromise and set their limits and structures together, so each one understands what the other one wants. And that's hard, because the kid doesn't want to listen to the parent and the parent wants to shout at the child. So it has to maybe sometimes be with the therapist, right? So relationship with peers. Peers, they felt that feeling of belonging. Again, we're going to the peers away from the family. We're learning other cultures and people. We know that best friends are really important in the adolescence. How they're going to treat their best friend is usually how they're going to treat their partner in life in the end. If they're really good to their best friend and thoughtful, then their partner in life is also going to be treated in the same manner, okay? So best friends are really important. So how do you build a rapport with an adolescent? Probably the hardest thing is you have an adolescent come in with the parents, and there are many of them just don't want to be, let's say in the ER, where the last place I worked, so how do you build up with them? Well, first of all, I might see something on the kid. Maybe it was the new iPhone, or maybe it was a really cool pair of sneakers, or maybe I saw a piece of jewelry or maybe their hair was like really cool. I'm going to start talking to them first. Or I hear the music in their ear. That's a good one. So what sort of music do you like? Have you seen him in person yet? Oh, I just went to this one and oh, it was really good. So did you like that one? I don't know if I like that music. And it becomes now we're talking, all right? Talk to them about their friends, what do they like to do on the weekend, etc. Another thing, this is the age, again, of identity. They don't know if a girl wants to be a girl, a boy wants to be a boy. They are sometimes girl dresses like boys or more manly. So, I might ask that person, Let's say, you know, their name is Rochelle. And I would go, how would you like me to call you? And they might say Ray. So, okay. So now what I've done is I've shown the adolescents I see and I'm respecting you. Okay. So I've actually said, I've respected you. I'm actually asking you, what do you want to be called first? Another thing is anything you don't understand in any child, ask a parent. A parent would rather you ask them than you proceeding and really not knowing. Now, a lot of the hard things is with children is talking about things in front of parents and sometimes referring this adolescent, they're not going to talk to you, tell them to go to their school nurse. School nurse is always a great resource for these children. Adolescents is the HPV vaccine that they're getting, and that is given about age 12, prevents HPV. Again, nutrition, they're not eating what they should. Remember, this is identity. I'm too fat. I need to lose weight. You know, I need to do, you know, this and that to look better. Nutrition is a snack bar and a bottle of water and go on many of these children. So, and they're so busy, school, social events, you know, they're always go, go, go. So are they eating right? Well, probably not. So if there's any issues with diet, let's say they're then diagnosed as diabetic or they're having other problems, you know, keeping a 24-hour diary can really help. Look at what are these children eating and how can we fit something in there? Now, adolescents, because of this growth spurt, should be sleeping as much as infants, but they don't. Why? Well, they're going through school. They need to get good grades so they get their, you know, scholarships to get into college. Then you have your best friends and your boyfriend talking on the phone. And then you have a game on the computer that you need to play and you're not sleeping. And that's normal, okay? Children, adolescents do not get the rest they need, although they need as much sleep as an infant. They need to exercise and they need to take care of their teeth. Again, they're the permanent teeth. So I said sexuality, these really, if you can't speak to the parents, and I wouldn't talk to my parents about it, I know that for sure, you know, school nurse, you know, and it's, you can, if there's something around, Planned Parenthood. Safety, injury, motor vehicles, again, number one. Firearms is another one, that experimentation. Sports injury, they want to be the best as they can be. Many of them want to, you know, get the football scholarship or, you know, baseball scholarship, and they're just pushing themselves to the absolute maximum. So trying to prevent injuries as possible. So Matt is 14. He's always eating, although his weight is appropriate for his height. The best explanation might be what? What did I tell you about that age and that adolescent growth spurt? Right there. He's eating because he's squirting up taller. Yes, it is A. Yes. Absolutely normal. So now we know about school age and we know about adolescence. It's mostly the approach there and trying to understand what they're going through. So I have a Kahoots now that will bring up some other concepts that I, you know, didn't go through with PowerPoints, but you'll be getting them now. Who wants to win today? Anybody? Jessica, you're gonna win today. Jamie, you gonna win? Maybe.
I'm certainly thinking about it.
There you go. Ulexis, yeah?
Yeah.
There you go.
Let's see.
There you go. How about you, Ashlyn? Yes, no, want to win? Lauren's gonna win, I can see it. All right, let's get going. School age, adolescent. How does the onset of pubertal growth spurt compare in girls and boys? Pubertal, which means at puberty, there is a growth spurt. Is there a difference? Girls is 2 years before boys. And this is when all of a sudden the girls are taller than the boys and they're all shorter. And then all of a sudden you come back after 8th grade summer break and that go into 9th grade and all of a sudden these boys are like a foot taller. I noticed it with my daughter, the change in 8th grade summer break. At what age should a parent expect to have major conflicts over independence and control with their child? What ages did I tell you falls right in? They're not old enough, they're not young enough, they're just, they want to make trouble. I want to go and do what I want to do. And yes, it is. It's 15 to 17. Good. The onset of puberty in boys is characterized by what? What happens first? Remember, this is all Tanner's going through the stages. And the first thing is testicular enlargement, okay? First thing that you'll see. Signs of onset of puberty in girls is what happens to her? So this is when they start to develop breast buds. So boys, you get the enlarged testicles, and in girls, you get the breast buds. They start to become women and men. The source of injury, whether intentional or unintentional in adolescence, is associated with so when you talk about injury, intentional or not, motor vehicle, because adolescents are now driving too. So they're driving and they're in the car as a passenger. A parent feels uncomfortable talking about sex education. Who's a resource? Who would you send them to? Absolutely. The school nurse is absolutely a great place. Peers are not going to give them accurate information because who knows if they've experienced what the question is they're asking, or they're just talking like the experience is there. A 9-year-old friend tells him soccer is a dumb game and he should play baseball. 9-year-old, school-age child. His friend, his peer, tells him soccer's dumb. He should play baseball. And this is all about peer acceptance. And you know something? He's going to play baseball whether he really wants to play soccer or not, because he wants to be accepted by his peer. During admission, the father of a 16-year-old says, "We are Buddhist. Culturally competent care includes." Remember, when you have a culture you're unfamiliar with, I would always say, is there anything I need to know so I can better take care of your child? Things do you need? Things I shouldn't do? And again, always ask. That preference and care is so much important. And it could be that they are vegetarian. So now make sure that their meal tray is vegetarian. Or maybe they need to do some sort of religious something. Well, as long as it doesn't interfere with the medical care, it's okay. When teaching sex education and contraceptive for adolescents, what should the nurse consider? Like, can we teach sex education and contraceptive? Are we allowed to do that? And we are allowed, but we cannot put our personal opinion into it. What we can do is give them information in oral and written form, and they can make up their own mind. Okay, we can tell them of the Planned Parenthood, or we can give them a brochure, or whatever, but we can't say, you know, I really don't think you should, you know, it's not going to be your man forever or whatever. But no, you cannot do that. Wish we could, but we can't. A multi-select. The management of adolescent obesity should include what? You've got a 15-year-old who's overweight, you know, and they want to try to lose it. So when you have an adolescent who's obese, number one, we want that 24-hour diary, right? We don't know how they're eating, what they're eating, but in any diet, if you don't put in something they like, sometimes it's too difficult. For me, I want sundae and I want some ice cream. I don't have all the stuff on it. I just want a plop of vanilla ice cream. And then that would say, all right, I've got something to work forward to. Diversional activities during meal times works more in the younger children, and nutritious food as a reward. They don't want nutritious food, okay? They want the good stuff, you know, bag of chips. Infants go through a predictable sequence of growth and development. This is called what? Every now and then I'll throw other weak stuff in here. Predictable sequence of growth and development. And it's called sequential trends. Very good. And Lauren's on fire. Which of the following drugs is most common drug of abuse in the adolescent population? You know, of these drugs, it is alcohol. I mean, you could say probably marijuana, but alcohol is also abused in quite a bit. It's easy to get to if the parents are drinkers. And I have heard stories of them taking the bottle and putting it in a water bottle, another container, and filling up the bottle with water and putting it back in the cabinet, and they didn't know. And, you know, then these children, I've seen them come in on alcohol poisoning. They were so drunk, they could barely breathe and they were vomiting. So, I mean, alcohol, we don't think of it a lot, but let me tell you, you're going to see some stories if you ever decide to work in the ER. Which benchmark serves as the ending period for the middle years of development? What happens at the end of the school age, that middle years? It begins with the losing of the teeth and it ends with wisdom, with all of your teeth, and puberty. Puberty is the end of school age into the beginning of adolescence. It's usually at 12, 13, according to the book. An example of indirect bullying would be if, I mean, we talked a little bit bullying about being in clubs and I mean, sports that are all over, kids, school. I get an A and you didn't, you know, they're all over. But that's a direct bullying. How today it's so easy. and it's that social media, and they've been using it. And, there has been times where children were so distraught, they committed suicide with it. So it is a really serious crime. It really is. What action would improve dental health in all school-age children? So not only just brushing, flossing also would be really good for all age children, school age and up. Generally the earliest stage at which puberty begins is what? We know it's 2 years apart, girls earlier than boys, right? So it's 10 in girls and 12 in boys. That is usually the ages you will see. An 8-year-old girl says that she has cancer because God is punishing her for being bad. What does that mean? I fell out of the tree and broke my arm because I punched my brother yesterday because I was bad, because God is punishing me. And it's an absolutely normal, common thing that occurs at this age. Remember, I talked about the little boy getting, or a couple of them actually, getting appendicitis, and just talking with them, telling them they did nothing wrong, okay? Very important thing to let our children know. They did nothing wrong if they broke their arm, appendix, whatever. Even if they punched their brother or did poorly in an exam or lied to mommy, it wasn't God. A 5-year-old needs to get a chest x-ray. What explanation is the best? 5-year-old, 6-year-old, right at that early school age. So the technician will use a large camera to take a look inside. It's not an x-ray. It's not a pictures, a lobes of the lung. They have no clue what that means. You don't have to go that deep, but I'm going to say, and when we're done, I'm going to show you the picture, and I'll show you your lungs and your heart. Isn't that cool? And they'll be excited to get it done. Come back, I put the picture up, and I go, wow, look at my heart, mommy. And you show them the fist, and that's how big it is. You have a lot of fun with kids. As I said, I went to work every day to play. How do you get an adolescent to open up about their sexual history? I had a very easy way to get with adolescents, and they used to tell me things I wish I never even knew. And then you have to stand there like you're not shocked, right? That was the hardest part for me. But again, just start talking about you first, and then with music and this and that, and then say, okay, so you're having another urinary tract infection. Do you think you know why? And then talk to them, and they'll probably tell you, yeah, because I'm having sex. So then you talk about that and try to help them not get more infections, right? How can you get an adolescent to be more receptive to talking about their health and sexual exploration? So first things first, get the parents out of the room. Most adolescents will not talk in front of their parents, and this is a good thing to do. Now, these adolescents can open up to you about anything. The only time you need to tell the parents what they said is if it's something that could give them harm. If they're going to harm to themselves, to others, this is something that the parents need to know. Besides that, you don't have to tell them. A multi-select. When educating adolescents about risk for HIV and hepatitis, what would you include? So we are going to promote abstinence, condoms, hand washing. You know, if we can have it, at least if they're sexually active, make sure that they understand the need for condoms. At least, you know, we're giving them some sort of protection. You know, abstinence always is the best, but they're not going to listen. You know, adolescents want to be adults, and they do need to make mistakes, but we don't want it to hurt them. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist? So we put it in cold milk, baggie, something, bring it in. And what they do is they take this lidocaine gel, put it there, let it sit, whether it's upper or lower. Usually it's the front teeth. And then the dentist comes in and pushes it in. And then they need to be on a soft diet for the next week. And then they follow up with dentistry. Many of the time, these permanent teeth do recatch. They don't have to go in and get a post and a fake tooth, etc. So it is something that does work. I've seen it work. A nurse planning care for a school-age child should know which thought process is seen. School-age children. What did I tell you about school-age children? School-age children and my little Debbie cakes. They have the ability to conserve. Animism, preschooler. Magical thinking, this is your preschooler. Thoughts are powerful. You know, that could be anybody's thought. It's just not school-age children. So they conserve. They know the little Debbie's cake has to last all week long. What stage of Erickson would you use for a school-age child? What did I tell you about school-age child with Erickson? They like to do tasks well, but they are upset when they can't do everything well. So industry is what they can do well. Inferiority is what they can't do well and they would really love to, okay? So again, please go through your Erickson, you know, go through these. You're going to see these. They're going to be on your exam. I'm telling you they're there, and it will be on your HESI. Multi-select. Anorexia nervosa is characterized by what? Now, this is one of the eating disorders. Adolescents know that this is, I didn't put it into the PowerPoint because it just needed a little bit of understanding. Remember, adolescents are into their body image, and many of these adolescents feel like they're too fat. And this sometimes can go into anorexia nervosa. What anorexia nervosa is they don't put anything, barely even water in their mouth. Might be a leaf of lettuce, you know, and a glass of water. They're afraid. And then they're doing, you know, exercise, fear weight gain, severe caloric restriction, unrealistic body image. So this one, they do not eat at all. How do you know if you suffer from bulimia? What is the difference between anorexia nervosa and bulimia? So with bulimia, you eat everything in the cabinet and the refrigerator, and as you're eating, you're vomiting. You're vomiting, you're vomiting. So you get the feeling of the food, but you immediately vomit it out. Now, what you would see with a bulimic and anorexic child, they're both going to be thin, okay? But the bulimic child, because they're vomiting, you're going to see rotten teeth from the gastric acid. That's the difference you will see. An anorexic child will have nice teeth. The bulimic is probably going to have some rotten teeth because of the vomiting, okay? That makes sense, doesn't it? The leading cause of death from unintentional injuries in children is, I think you got this one down good now, don't you? Motor vehicle fatalities, absolutely, good job. Adolescents are, where are they? They're somewhere between being a child and an adult. So at this point, do they still want to be a kid? Do they want to be independent? They don't know, so they're confused, troubled, frustrated. They want to do, mommy says no. They want to go, mommy says no. All of these rules, all these regulations, frustrated, confused. So yes, answers 1 and 2. What is an adolescent's heart rate? So it is 55 to 90. Adolescents tend to be more active generally. And because of that, their heart rates are slightly lower than your normal adult, 60 to 100, okay? So 55 to 90, good job. When talking with an adolescent regarding personal health concerns, which is most important? So you want to give them that opportunity to be able to say whatever they want. Again, be aware that they may say something that shocks you. So be prepared not to be shocked, okay? Because sometimes adolescents want to see if you say something or a way you respond to what they tell you. They want to give you a shock. It's just what they do. A parent says their infant puts everything in their mouth. Based on Freud's theory, you would respond. Well, what does Freud say all about the infant? Freud talks about that sucking, chewing, biting, all of those things creates security and stress reliever on them. And he also says that through the exploration of the environment, first of all, everything's in their mouth. They start with fingers, then rattles, then toys. All of this is the way that they go through life. Similar to Piaget, right? But this talks about that exploration also with it. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 are So remember your adolescents, you know, peer acceptance is important and body image is important. And what you see is homicide, suicide. And it's because they are doing risky behaviors, not thinking about it because of their peers. And the suicide is that body image. You will see teenagers committing suicide because of life where they are, or because of their body image. So be aware that those are two big causes of injury in your adolescence. So if an adolescent mentions anything about wanting to kill themselves, let me tell you, take it extremely serious, because they probably will. In school age conflict, industry versus inferiority. What does industry mean? So industry is what they do and what they do well, and that inferiority is what they can't do, and it frustrates them, and they want to do it well. Good job. At what age does intuitive thought start? Bring you back a little bit. And that's about 5 to 7 years old. And this is when they start thinking of putting things together and understanding this is a square, but this is a square. If I put it on top of each other, it's a four-sided here and there. And, you know, talking with my grandson, intuitive, he knows 25 is a 5 by 5 square. It's all a square because he knows the boxes up and down. And this is, and he knows 9 and 9 is 81. And it's all this intuitive thought. This is all this thinking. If the boxes are equal, this is what it is. And this is what it means, intuitive. Which age group prefers to be with members of their own sex? Who wants to be with their peers, same-sex peers? And that's your 9 to 11-year-olds. The younger ones, still not yet, but when you get at that later part of school age, absolutely, they want to be with peers of the same sex. Which age group would have a tendency towards eating disorders? And that's your adolescents, but be very careful with your older school age children, because some of them also could have those eating disorders, depending on even with the parents and what they've done to them. If they were pudgy, they put them on diets, they could be towards those eating disorders too. True or false? Home support is invaluable to the adolescent. Do they need home support when they're adolescents? They still need mom and dad. What if something happens out there? Their best friend gets in an accident, or, you know, they failed a test at school, but they knew they did good and they just want to come home and cry on mom and dad, right? They still need mom and dad there. Very important. It's just, in fact, more important now. Parents need to be sitting on the outside waiting to catch them as they need to. Contraindication to administering the varicella vaccine to an adolescent. Talked a little bit about vaccines and when do you give vaccines and when you do not give vaccines. Doesn't matter, an adolescent, an infant, an adult, they're all the same answer here. And it's, are you currently taking corticosteroids? Prednisones make you immunosuppressed, right? Think about that. These are types of questions you're going to see. I believe this was an NCLEX question that one of the students gave me. So knowing that live vaccines, you cannot be in immunosuppressed condition or because of medications like steroids, okay? Or me, my infusions. To improve adolescent health, adults must increase health enhancing behaviors like what? You know, adolescents tend to get up and run and go, and what should they do? Or more of? So if they had better foods and they had better exercise periods, and then of course the sleep, get off the phone, put it down. Your best friend, boyfriend can wait till tomorrow, right? What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? Which one doesn't say anorexia nervosa? Does not. So bulimia is decay in teeth. All those other things look like hypothyroidism, doesn't it? Dry skin, intolerance to cold, constipation. Those are all you see in hypothyroidism. But because of anorexia nervosa and not getting proper nutrition, they're probably depleted in the thyroid hormone also at this point. Their body is shutting down. The risk of depression in transgender children is what? You know, I think many of these TV shows on TV have really opened the public's eyes to, you know, things that children go through, especially the transgender child. And we know that because of the confusion and lack of acceptance, etc., their level of depression and suicide are higher than most children. A 14-year-old in the emergency room after a biking accident. How should the nurse interact with the adolescent? So the child comes in on the rescue. You're the nurse with this child, that you're talking to this child. How can you keep this child comfortable, calm, and feel like they're in control and not as scared? You're going to give that child, okay, you're in the emergency room. A lot of things will happen, this and this and that. We're going to do this and we're going to do that. Now, having the parents in there, sometimes they're not there yet, especially when the child first gets there. Sometimes they come in afterwards. Many of them are not on the ambulance, okay? So having the parents there in the very initial, because of all the x-rays, etc., they won't, but right after, then they bring the parents in. And just let the parents know that he's okay. Cooperative play, what does that mean? As I said, I went to work in pediatrics and I played every day. So kids are working together to meet a goal, whether it's playing a board game of checkers, right? But they have to decide together, work together to do something because they're going to make something, whether it is, you know, a house made with blocks, or playing checkers and somebody wins, or a board game. Very good. What does moral development involve? Who talks about moral development? Isn't that Kohlberg, the theorist Kohlberg? What does he say? And it's all about right and wrong, and a consequence for right and a consequence for wrong. Good. Developmental milestones are important to observe because of what? because we're going to see these delays or something that's not right, and to be that clue to getting early intervention or even preventing things from happening. So yes, developmental milestones are very important. Lymph nodes in children with normal findings should be what? And they should be absolutely non-existent. You shouldn't be able to feel them. They only have lumps when the child don't feel good. That shows an infection. The right second intercostal space landmark of the heart is called. Go back and look at your assessments. Know where to look for the apical, the mitral, aortic valve. Know which one is where. So the second intercostal space landmark is the aortic valve, okay? Which nerve controls movement of the tongue? We talked about this earlier today. Brought you back to health assessment. It's the glossopharyngeal and or a hypoglossal, and you can watch the tongue stick out and move, and we can say that it is functional, it is working. What type of breath sounds do you expect to hear over the trachea? I also went over this, there's the trachea and then there's breath sounds. What do you want to hear over there? So the trachea is basically the bronchi, right? It's all that upper airway mucus. It is bronchial breath sounds, okay? When you're talking about the bronchovascular, you're almost into the lungs, okay? Tracheal, they call it actually the bronchial, not tracheal. Depriving a child of food, clothing, and shelter is a definition for what? So it is called neglect. And some of these things, there was an incident where children are outside in the front yard playing ball. It was 30 degrees out, and the ball went into the road, and one of the kids almost got hit. So they called the police, whatever. The police came and actually arrested the parents of the child that was outside because the children didn't have coats on. It was considered neglect. It was 30 degrees outside. So food, clothing, and shelter. So yes, so just for you to remember, neglect can be perceived that way. Which of the following immunizations is given in the adolescent stage? Oops, and that is your HPV vaccination. ADHD most likely involves which of the following? I mean, to have attention deficit hyperactivity disorder is a very hard thing for the child and for the parents. And it is that inattention, impulsivity, and hyperactivity, and the inability really to finish anything. And usually that child is that disruptive child in the classroom. Again, always listen to the parents about what they've tried to do already. Don't assume that they're not doing anything at all. Last question. Adolescents typically place blank on peer relationships. You know, adolescents absolutely thrive on being accepted by peers. So it is a high value. All right, let's see how we did today. Number 3, Jessica. Good job, Jess. Number 2, Jasmine. Good job, Jasmine. Number 1, whoop, 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 whoop. Lauren. Wow, good job. Number 4, Kanisha and Alexis. Good job. What I'd like you to do is sign your attendance attestations that they're done. You all did a great job this week. I really didn't have to send in any sort of reminders, so good job. Any questions I can say for you? Anything you need from me? If not, we're done for today. It was a good day.
One more question. You said the review's tomorrow evening, right?
I am doing my review tomorrow at 5:30, but you
Okay.
are having Professor Morris on Wednesday, Professor Okorafor on Thursday. You will get recordings to everything.
Okay.
And I will be sending you that dosage calculation handout, so you will have them.